Orajel contains benzocaine, a local anesthetic, numbing medication. It works by blocking your signals in your body. Orajel numbs the skin or surfaces inside the mouth and used for the temporary relief of pain from sore throat, conky sores, cold sores, fever blisters, minor irritation or injury of the mouth and gums. How to use. Use Orajel exactly as directed on the label or as prescribed by a doctor. Read all medication guides or instruction sheets. Your body may absorb more benzocaine if you use too much, if you apply it over large skin areas. Use the smallest amount needed to numb the skin or relieve pain. Don't use large amounts of Orajel. Do not cover treated skin areas with plastic wrap without medical advice. Don't use Orajel to treat large skin areas or deep puncture wounds. Avoid using the medicine on skin that is raw or blistered, such as severe burn or abrasion. Call a doctor if your symptoms do not improve or if they get worse within the first 7 days of using Orajel. Also call a doctor if your symptoms had cleared up but then come back. If you are treating a sore throat, call a doctor if the pain is severe or lasts longer than 2 days, especially if you also develop a fever, headache, skin rash, swelling, nausea, vomiting, cough, or breathing problems. Contraindications. Don't use Orajel if you have ever had hemoglobinemia in the past. Don't use Orajel on a child younger than 2 years old. An overdose of benzocaine can cause fatal side effects if too much of medicine is absorbed through your skin and into your blood. It can happen if you apply more than the recommended dose. Ask a doctor or pharmacist if this medicine is safe to use if you have a personal family history of hemoglobinemia or any genetic inherited enzyme deficiency, asthma, bronchitis, emphysema, or other breathing disorder, heart disease, or if you smoke. Ask a doctor before using Orajel if you are pregnant or breastfeeding. If you apply Orajel to a chest, avoid areas that may come into contact with the baby's mouth. Precautions. Avoid eating within 1 hour after using Orajel on your gums or inside your mouth. Avoid getting Orajel on your eyes. Avoid swallowing the gel while applying it to your gums or the inside of your mouth. Orajel side effects. Orajel used in the mouth may cause a condition in which the oxygen in the body tissues can become dangerously low. This is a potentially fatal condition called hemoglobinemia. This condition may occur after only 1 use of benzocaine or after several uses. Signs and symptoms may occur within minutes or up to 2 hours after using Orajel in the mouth or throat. Get emergency medical help if you have a headache, tiredness, confusion, fast heartbeats, feeling lightheaded or short of breath, pale blue or gray appearance of your skin, lips, or fingernails. Get emergency medical help if you have signs of an allergic reaction to Orajel, hives, difficult breathing, swelling of a face, lips, tongue, or throat. Stop using this medicine and call a doctor at once if you have severe burning, stinging, or sensitivity where the medicine is applied, swelling, warmth, or redness, oozing, blistering, or any signs of infection. Common Orajel side effects may include mild stinging, burning, or itching where the medicine is applied, skin tenderness or redness, dry white flakes where the medicine was applied.